Thank you very much for the privilege of speaking with you today on a very important topic in a woman's life. And I just came back from 4 days at the annual meeting of the North American Menopause Society. So in the 2 hours that we have, we should be able to scratch the surface. Oh, 20 minutes? Oh, we can make a little dance. Okay.
Yeah.
So if
I said we only had 20 minutes now. Get going.
so if Dr. Alfonso's song was "It's All About the Bass," my song, at least one of them, is going to be "Heat Wave," or "This Girl Is on Fire." So what are we talking about in menopause? The definition is defined as no menses for 1 year of life, 1 year at the appropriate time in life. So actually saying you've gone through the change of life or you've gone through the menopause is a retrospective diagnosis, because you have to wait a year with no periods to say that you've entered menopause. The average age, as was mentioned before, is about 51, 52 years of age. And our population is aging. We have 64 million women in the United States over the age of 50. That's 20% of the United States population. So menopause happens because the ovary essentially runs out of eggs and people stop making estrogen. Now, again, this is a major issue for women because that the age of menopause has not changed in hundreds of years. It's related to the ovary, and as was mentioned before, you were born with a finite number of eggs. Now, if you make it to age 50 today, your average life expectancy is going to be about 85 years of age. That means that about 40% of a woman's life is going to be postmenopausal. So this is a very significant time for people. And what kind of symptoms do we have? Well, the symptom that people really know about is the hot flash. Or if it occurs at night, it could be night sweats. It's what doctors refer to as vasomotor syndrome, the vasomotor symptoms, or VMS. And it is a big problem for people. About 85% of menopausal women experience hot flashes, VMS. It can start about 3 or 4 years before the actual menopause. And what is interesting about vasomotor symptoms is that the earlier they occur and the more intense they are, it puts you at increased risk for cardiovascular disease. The reason for that is that estrogen is protective to the lining of blood vessels, which is called endothelium. When you lose estrogen, there's more chance for the endothelium to get damaged. That damaged spot is an area where atherosclerosis can start. So once you lose estrogen and your vessel can be potentially damaged, you're at risk for cardiovascular disease. We said that about 85% of people will experience them. They may occur for up to 10 years past the actual menopause. And unfortunately, there's a small percentage of people, about 8% of people, where they never have a cessation of their hot flashes. Sorry. Now, it turns out that a third of women who are experiencing hot flashes, vasomotor symptoms, don't seek help. And there's a lot of reasons for that. There are cultural changes in some societies. When a woman goes through menopause, she's not able to have children, and that is a decrease in her value. So women may be reluctant to say they're going through menopause. Some women are afraid to bring up the subject because they're afraid to embarrass their doctor. You can't embarrass us, okay? If you're having symptoms, we want to hear about it. But it is a problem. Again, as we said, about 64 million people in the United States are going through menopause. A third don't seek treatment. That is 20 million women. By the year 2025, it is estimated that globally, 1.1 million women will be in menopause. That's a lot of heat. Have we discovered the cause for global warming?
No.
Other less known symptoms, which were somewhat brought up a little bit, are what we call genitourinary symptoms of menopause, or GSM. Vulvovaginal dryness is an issue. With the loss of estrogen, you lose the connective tissue in the vulva, the outside of the vagina. That can cause pain. Women get vaginal dryness. That can result in difficulty with intercourse. And we talked earlier about urinary problems, and that's going to be a lack of estrogen. We are women are sexual people. And the only thing that keeps a woman from being sexually active until the day she dies is a socially acceptable, functioning partner. So if you're going to spend 40% in your life in menopause and you're having vaginal dryness, that's not good. So if you have those symptoms, you need to talk to us. Other issues that are a little bit less known are sleep disturbances. If you get woken up by your hot flashes, that will cause you to not sleep well. And that's relatively common. About 25 to 75% of women will have sleep disturbances. If you don't feel good because you're not sleeping, you can have increased anxiety, increased depression, and sleep deprivation has been linked to an increased risk of Alzheimer's. So again, it's important if you're having these symptoms to get treated. Let's talk about some health problems that we have associated with menopause. We'll work from the bottom up, maybe. Cardiovascular disease, we do know, I mentioned just a moment ago, that if you have more intense vasomotor symptoms and they start earlier than you would expect, you are at increased risk for cardiovascular disease. This has been recognized by even the American Heart Association. So this is a significant problem for women. We talked a little bit about depression. A more significant problem that we really don't hear a whole lot about is osteoporosis, loss of calcium from bone. And when that happens, you lose bone strength. 50% of postmenopausal women will have some type of osteoporotic fracture. That can be the little collapse of the vertebrae. So you get sort of that stereotypical old lady hunched over and has a curved back. You can develop a hip fracture, and a hip fracture is a very serious thing in a postmenopausal woman. There is estimated to be about a 20% risk of dying in the first year after a hip fracture. And about 50% of postmenopausal women with a hip fracture do not regain their full mobility. They have to wind up walking with a cane, a walker, wheelchair. So this is a significant issue in the menopause. So what's the treatment for all this stuff? Estrogen. Estrogen is the most effective treatment for vasomotor symptoms and the most effective treatment for really all of the issues of menopause. One of the indications for estrogen is the prevention of osteoporosis. So estrogen is a controversial subject. Back in the 90s, we had observational studies that talked about the fact that women in their 50s and early 60s did not get heart attacks at the same rate as men. So it was felt that estrogen was probably protective to the heart. The major manufacturer of estrogen at the time wanted to have prevention of cardiovascular disease as an indication for estrogen and asked the FDA to allow that. The FDA said, we need a study. So they did a study. It was called the Women's Health Initiative, and you may have heard of it. It was stopped early because it was discovered that people had more heart attacks on estrogen, and they had an increased risk of breast cancer. Well, small problem with the Women's Health Initiative is that we took women who were asymptomatic in their 60s and 70s and started them on estrogen. We don't do that. That's not the people that we give estrogen to. And it turns out that if you have atherosclerosis and you take estrogen, you're sort of destabilizing your atherosclerosis briefly, and you get a stroke. You get a heart attack. The clot gets separated off of the blood vessel. But we don't give estrogen to women who are that old. And I want to give you this is a study, this is a slide that talks about estrogen. We know that estrogen today, if we started within 10 years of the menopause symptoms, or between age, say, 50 to 60, estrogen is safe. The risk of breast cancer is actually in women that take just estrogen rather than estrogen and progesterone. And you have to have progesterone if you have a uterus because it protects the uterus. But estrogen is very safe. And actually, the risk of breast cancer occurs after about 5 years of usage of estrogen and progesterone. And it turns out it's probably the progesterone. We don't use medroxyprogesterone acetate anymore. We use micronized progesterone. And this is basically, if you look at, this is slightly increased risk of deep vein thrombosis, but this risk is 5 out of 10,000 people. So if you take a look at the slide, you'll notice that actually in women that take just estrogen over here, there's actually a decreased risk, and the all-cause mortality goes down. So it is actually very, very safe. When we talk about estrogen, people will talk about bioidentical estrogen. And bioidentical hormones is really a trademark type of marketing type situation for compounding medication at the pharmacy. And it's really not good because you don't have sterility, you don't know if it's the same potency in one batch versus the other batch. And we can give you bioidentical estrogen. Estradiol is the estrogen we use. It's the same estrogen that's floating through your body. And we can use micronized progesterone. So you don't have to use bioidentical compounded hormones, because we are giving you bioidentical hormones. in our normal treatment. So I'm going to stop now, and I will tell you that if for women that can't take estrogen, there is some non-hormonal medication. Some of these things are related to they increase serotonin, and there are other medications that we can give. So if you can't take hormones, we do have other preparations, but estrogen is very, very safe for the average healthy woman who does not have breast cancer, doesn't have an endometrial type related cancer or a heart attack or a stroke. But if you're between the age, if you're 10 years from the menopause and you are healthy, estrogen is very, very safe. So I would encourage you to talk to your doctor and discuss whether or not treatment is good for you.